Hi, this is in response to a question about vertical lifts. What are vertical lifts? Well, vertical lifts are when doctors come from above through the temple, come down into the midface, grab a bunch of tissue with a stitch, and lift it directly up. At most, you're releasing this ligament if that's happening at all. And you're relying on a stitch to grab and bunch everything in a directly vertical fashion. That's assuming that you're only aging directly down, but we're not. Our muscles in our face are pulling us towards the center. So we age in this direction. So you're only getting half of it right. You're missing the lateral pull. And if you went all lateral, you'd have a very similar problem that I did earlier, which I had a video explaining the lateral sweep or the joker mouth. So you want to pull upward and outward, not just up and not just out. Pulling just up gives you a very bunched appearance. You're missing restoring volume in front of your ear, and you're not going to have a very natural result.